Awesome. Well, hi, everybody. My name is Lisa Majeski. I'm the owner and president of Gold Star Medical Business Services, and I'd like to welcome you here today to our webinar series on DME billing and DME credentialing. And we had a great crowd last week. We did part one of this series, which was on coding and billing for DME, specifically to speaking to orthopedic braces, back and knee braces. Of course, DME is a big category. You know, there's all kinds of DME that you can be a supplier of. We are focusing on orthopedic braces, but this particular presentation today is one that will apply no matter what kind of DME supplier you would like to be, or what type of DME supplies you would like to offer to your patients, or if you decide you wanted to open up a medical supply company, this would also apply to you. And this is a very basic, introduction on how to become credentialed to be a DME supplier. So I'm going to go ahead and share my screen with you. We'll go ahead and just launch right into this. So the first thing that I want to do when we talk about DME, and I think that there is always a lot of confusion about this, especially amongst doctors who decide that they're going to want to offer DME to their patients, is that when you become a DME supplier, that is exactly what you are. You no longer are a provider. You are a supplier of durable medical equipment to your patients or to the general public. A DME supplier is on the same level as, let's say, a pharmacy. So, you know, a pharmacy does not do medical procedures. A pharmacy dispenses medication. They'll dispense DME, and so a pharmacy understands where that limit is from being a provider to being a supplier. So I want you to think about the workflow. If you're listening to this and you are, let's say you're a physician or a nurse practitioner or a PA, a physical therapist, when you are evaluating your patient for DME, for any type of durable medical equipment, you're acting as a provider. So during the evaluation process for DME, you are billing out to your commercial payers, or you're billing out to Medicare Part B as a provider, not as a supplier. When you order the DME and then you dispense it to your patients or to the general public, you're acting as a supplier, not a provider. And then if you're going to also instruct a patient on the proper use of that DME, you are then putting your other hat on and you're acting as a provider. And the reason why this is important is because the billing is different. If you are billing as a provider, you are billing, especially for Medicare and many Medicaid plans, you're billing to that particular plan as a provider. When you're dispensing DME, you're billing as a supplier. For Medicare, it's two different Medicare contractors. So you don't even bill your DME to your regular Part B contractor. You have to bill your DME to the what's called the DMERC, or the DME regional contractor that would be the contractor for your patients. So for Medicare and for some of the Medicare patients that you dispense DME to, this means that you must have a separate credential as a DME supplier. Your Medicare Part B credential or your Medicare PTAN as a Part B provider is not acceptable when you want to dispense DME. And so it requires a whole different level of credentialing than what you already have in place or what you've done in the past. Now, for commercial patients, meaning the patients who are under a commercial insurance plan, group health, these patients, most of the time, DME is paid under your managed care agreement. So it's kind of business as usual. It's just that you need to know how to bill it correctly for your reimbursement. And in most cases, a separate credential is not required for DME under the commercial plans, but for Medicare, it definitely is. And for many Medicaid credentials, you have to have a very specific DME supplier credential to be able to dispense to some of your Medicaid plans. So, a question that I'm asked a lot when discussing credentialing to become a DME supplier is it worth it? Is it, it's a process to get credentialed as a DME supplier with Medicare. And so, and I will tell you, it's not for the faint of heart. You have to know what you're doing. You have to work with a reputable company that knows how to get this credentialing done for you. And so you do need to ask yourself the question, is this worth it? And so what I'm going to do for the rest of the presentation is we're going to talk about what it takes to credential as a DME supplier with Medicare. And then we're going to circle back to this question and help you answer it in your own mind as to whether this is something you would really want to entertain doing or not. So a few things you need to know about DME credentialing with Medicare. There are two types of Medicare credentialing for DME. You have a route called the accredited route, where you have to go through accreditation. Now, accreditation is typically reserved for medical supply companies. So organizations that want to sell DME to the general public and your patients, then you would need to go through accreditation. And we'll talk about who is exempt and who is not exempt from accreditation here in just a few minutes. And then we have the non-accredited route, which is where you just want to sell DME to your patients. You don't want people coming in off the street and asking to, with a script from another provider that's writing the order for the DME and you're just being the supplier. Medical supply companies do that. So, a lot of times if you're a medical doctor and you're listening to this webinar, what you may typically be doing right now is you may be evaluating a patient for a brace and then telling that patient to go to their local DME supply company that may have a storefront in your community and give them the script, and then that medical supply company fulfills that DME script. And so all you do is the provider side of it. You don't do the supplier side. So, but you can, if you want to, you can offer DME to your patients as a supplier. And to do that, you would apply directly to Medicare. Now, if you have to be accredited, and some types of providers actually do have to go through accreditation, even though you're only selling it to your patients, the cost of accreditation could be upwards of $5,000 or more, depending on what needs to be done. So to apply as a non-accredited supplier, and you're going to sell DME only to your patients, that all that is required is a direct application to Medicare, and you have to pay the Medicare application fee, which is right now sitting at around $600. And then there is a process that both accredited and non-accredited applicants would have to go through, but going through the non-accredited route is definitely more cost effective and also takes less time to go through, excuse me, that process of credentialing. Now, one of the caveats to credential as a non-accredited supplier, your corporation has to be owned at least 5% by a physician. And I'm going to show you a chart in just a few minutes that will outline what types of physicians or non-physicians would have to go through accreditation and which types are exempt. So hang tight, because we'll have that information for you here in just a minute. The other thing that you have to be aware of with respect to Medicare credentialing for DME is that it can take a while. You would need to be prepared for anywhere from a 3 to 6 month wait or longer, depending on whether you're having to go through accreditation. Some of it depends on what the Medicare backlog is of applicants and applications to become DME suppliers. And so you do need to be prepared for that. Now, the good news is with Medicare and the way Medicare applications work is that when you submit your application, providing you're approved, the approval date will be dated to the date of that application, the date that the application was received. And in some cases, they will actually go back 30 days prior to that. So you could technically be a supplier before your credentialing is approved, but it's a risk, because if you're not approved, then you will have been supplying those braces or that DME to the patients, and then you're not approved, and then you just have to write it off. You could balance bill the patient if you had the patient sign an ABN form. And definitely, if that's something that you wanted to discuss with me, the pros and cons of that, we could discuss that. But really and truly, your best bet is not to be doing any DME dispensing until you actually have that approval in your hand. And so otherwise, you're really kind of taking a risk. Now, the Medicare DME billing, as we discussed just a little while ago, actually goes through the DME regional contractor of the state, and remember this, in which the patient has permanent residence, not your Medicare Part B carrier, and sometimes not even the state in which you are providing that supply. I'll use this as an example. I had a client several years back who became a DME supplier for his patients. He lived in far western Pennsylvania. And far western Pennsylvania, the jurisdiction, and I'll just show you this jurisdiction map. So the jurisdiction map for far western Pennsylvania is Meridian, jurisdiction A or region A. He had a lot of patients that lived in Ohio. And because you dispense DME for use in a patient's home, you have to bill it to the regional contractor in which the patient has permanent residence. So because the provider was in far western Pennsylvania, he had to be credentialed through JA and JB jurisdictions. And so these are some of the things that you have to be aware of. So if you're in a state that borders a different jurisdiction, so let's say, for example, you're in South Dakota, far eastern South Dakota, and you've got patients who live across the border in far western Minnesota, you're going to have to be credentialed under 2 jurisdictions. And so be aware of that. Now, this also sometimes poses issues with your snowbirds. So for example, if you have a patient who has permanent residence in New York, but they're snowbirding down in Florida, unless they have some type of residence down in Florida, you'd be billing the supply to New York, to the New York jurisdiction. So that's just something that you need to be aware of when you are looking at credentialing and getting your DME PTAN through Medicare, is which jurisdiction or jurisdictions would you need to be enrolled under. In addition to the Medicare requirements, there may be additional state requirements or state licensing that needs to happen in order for you to be credentialed as a Medicare provider of DME supplies. And some states, depending on the supply that you are wanting to dispense, may have special licensing requirements for that specific supply. And so when you are looking to apply as a DME supplier, you need to be able to look up whether that your state has specific licensing requirements, and additional fees for those state licenses may apply in addition to your your Medicare fees and your accreditation fees. And just so you would just need to be aware of that. How do I find that out? So there's, that's of course going to be a big question is all right, I want to dispense braces in my state. And there are 3 different types of braces. You have off the shelf, you have prefabricated, custom fitted, and then you have custom molded orthotics. And depending on what you're wanting to dispense, then you would need to maybe have a specific license. How do you know where to find that information? And where you can start to do your research and really start vetting whether this is something you want to do or not is to get on the website for the National Supplier Clearinghouse. Now, the National Supplier Clearinghouse is the equivalent to CMS. So where, for example, we all know that if we're a Medicare provider, we don't bill claims out to CMS, but CMS governs all the policy and all and dictates provider enrollment and so on and so forth. The National Supplier Clearinghouse does the same thing for DME. And so while there are relationships between CMS and the National Supplier Clearinghouse, when it comes to provider enrollment, when it comes to policy, when it comes to state licensure, and other types of questions relating to DME, you need to understand that your first go-to place is going to be the National Supplier Clearinghouse, okay? And so I'm just going to run through a few slides here that this is a screenshot of the homepage of the National Supplier Clearinghouse. And you can see that they have a number of great resources. One is your application status. So if you did enroll as a DME supplier, or maybe you have an application in and you want to find out where you're at in the process, you can go to the National Supplier Clearinghouse and use this tool to find out how far along the process you are. If you need information about new supplier enrollment, or if you want to register for NSC webinars, which are awesome, you can do that. You can also, if you need to appeal your enrollment for whatever reason, and and whether you're appealing a denial or whether you're appealing a start date for your enrollment, you can go through the appeals process on the National Supplier Clearinghouse. Also, this important one is the licensure database. The licensure database is the database that you can go to that will allow you to discover whether you would need additional licensing or not in the state in which you're going to be dispensing the DME, or the state in which your patient resides. So the next screenshot that I showed you, there's another, if you go to the tools, you can also see that there are a whole bunch of additional tools, including the licensure database. So if you were to click on the licensure database, you would be taken to a licensure database homepage. And at the bottom of the page, there's a link that says view your DME POS state license directory. And if you click on that link, it will take you to a map of the US. So what you would do is you would want to click on the state in which you're going to be dispensing the supplies to the majority of your patients. And again, if you're in a border state, you may need to click on 2 different state requirements and find out, once you've clicked on the state, then you would look for the specific type of DME you are wanting to supply, and you will be able to find out whether you need additional state licensure or not. So for example, I use the state of Florida because we have a lot of Florida clients, and we have a lot of doctors who will dispense DME in the state of Florida. And so if you wanted to offer a supply of prefabricated, custom fitted orthoses, back and knee braces in the state of Florida, you will see that yes, you would be required to have a license through the Florida Department of Health and the Board of Orthotists and Prosthetists. And by going into this database, then you could click directly on that link to the Florida Department of Health, to the Board of Orthotists and Prosthetists, and it would take you directly to that website so you could obtain more information about what it would take for you to obtain that state licensure. So, doing your due diligence at the beginning of this process will save you a lot of time, a lot of money, and a lot of heartache if it turns out that this really is not something that you would, want to do. If it's just too much, too many requirements, too many hoops to jump through, too much money, you may not want to do it. But that is an informed decision that you would need to make. So it's not, when you're applying to be a DME supplier, you can't just jump into it and start filling out applications. You've got to do your homework first. So the question is, how do we get started? So what are the first steps we would need to do to get started on becoming a DME supplier? And the first thing you would want to do is determine whether you would need to become accredited or not. If you do have to be accredited, then you would need to go through an approved Medicare accreditation organization to do the application process. If you do not have to be accredited, then you would obtain access to your online Medicare application portal called PACUS to fill out that Medicare credentialing form online, or you could go to the CMS website for a paper copy of the 855S Medicare enrollment form and fill it out and send it in with all of the supporting documentation that would be required. There is a lot of supporting documentation that is required in order to start getting credentialed as a DME supplier. And depending on whether you are going through accreditation or not, you may have different rules for what supporting documentation and what supporting credentials you might need in order for you to get that supplier enrollment approved. I do not recommend, if you don't have a lot of experience with credentialing in your organization, I do not recommend that this be the first time you try to do it yourself. There are a lot of little minefields to navigate. And if you don't know what you're doing, or you miss a step, or you get a request for additional information and you don't follow up on it, what happens is you're given so much time to get this enrollment done. And if you don't get the enrollment done in the time that the payer or Medicare asks for, they can deny the enrollment, and then you have to start all over again. And I know that that's, the last thing that you want to do. So to get started, though, you do need to determine whether you would need to be accredited or not. Now, this little chart that came from Medicare has a list of the exemptions from accreditation and whether a surety bond would be needed in order for you to get accredited. So just so that you're not confused, if you see a Y next to your particular category, that means that you are exempt. So Y is good news. Y means that you're exempt from having to go through accreditation. An N means that you're not exempt from the requirements. So for example, if you're an optician and you're thinking about offering optical supplies, DME supplies as an optician, then you would be exempt from accreditation, but you would not be exempt from having to get a surety bond. So you would have to get bonded. If you are a physician, and if your goal is to provide items to your own patients as part of your own services, you are exempt from accreditation and you are exempt from having to obtain a surety bond. So that's good news. Now, physicians and non-physician practitioners who are identified in Section 1842B18 of the Social Security Act And this is a short list of those physicians that are listed. So it would be an MD, a DO, a physician assistant, a nurse practitioner, a certified registered nurse anesthetist, midwife, social worker, clinical psychologist, registered dietitian or nutritional professionals. And there's a longer list. Now, some of you may be listening to this and you are chiropractors. Now, if you're a chiropractor, you are actually identified as a physician under Section 1842B of the Social Security Act. However, the chiropractic benefit, if you are providing items to your own patients as part of your own services, you will know that the only thing that is covered under the chiropractic benefit for Medicare is spinal manipulation to correct a subluxation. Any other services that are either performed or ordered by a chiropractor are non-payable. What this means is that if you are a chiropractor and you own your medical corporation or your chiropractic corporation in 100% entirety, you would not be exempt from accreditation. You have to go through accreditation. So I do want to make sure, because we do have a number of chiropractors who are clients of ours, and they want to know what do I have to go through accreditation? And the reason why is because of the way Medicare identifies the chiropractic benefit under the Social Security Act. It is limited to the scope of spinal manipulation to correct a subluxation. That's all that's covered. So if you know in your mind, if I order an x-ray or if I order physical therapy or I perform physical therapy on a patient under my chiropractic credential, it's not going to be paid. We know that, but we don't understand that DME is included in that. So that is why, as a chiropractor, you must go through the accreditation process. Okay. There is additional information. This is just a short list, a little chart that gives you some information about your accreditation exemptions. But good news, if you're a physician or you are a physician-owned medical corporation. So let's say you are a chiropractor, but you have a medically integrated practice and you have a partial physician owner that owns at least 5% of your medical corporation, you would be exempt from accreditation. So that is good news for you if you are a chiropractor and you are in a medically integrated practice setting and you have a physician who is at least 5% owner of that medical corp, then you would be exempt from the accreditation requirements. So what about if you have to get accredited? Medicare has a list of approved accrediting organizations. If you have to go through accreditation, you do not want to go through a regular credentialing company. They are not going to be able to help you until you go through accreditation. So what you would want to do is you would want to, and this website that it is shown up at the top of your screen, and I've sent all of you handouts for the presentation today. And if you're listening to this after the fact, I can send you the handouts, and we can make sure that you have the full list. So this is it's about 3 pages. One of the most common accreditation organizations for those of you who may only be wanting to do orthopedic bracing or just general supplies for your patients is the organization called the Compliance Team. There are other organizations, the Joint Commission, the National Dialysis Accreditation Commission, but the Joint Commission typically does hospitals and psychiatric hospitals, okay? And so the Compliance Team is one that is fairly reasonable. I'm thinking most of my clients have reported that their accreditation process is in the $5,000 range. And so what you would want to do is, if you needed to go through accreditation, you would want to partner with an approved accrediting organization that Medicare has on their list. You can do your homework, make a few phone calls, let the accrediting organization know what it is you're wanting to get accredited for, and then find out what their fees are and what the process is. But the compliance team is probably one of the most widely used in the setting of of orthopedic bracing. And once you know which way you're going to go, accreditation or non-accreditation, then you have to start getting prepared. And one of the things that you're going to need to understand is that regardless of whether you're going through accreditation or not, Medicare is going to come in, the national representatives from the National Supplier Clearinghouse are going to come in and do a site visit. So what they don't want, and believe me, DME is probably, one of the biggest areas in the Medicare program for fraud. Okay. And so Medicare wants to make sure that you have a legit clinic and that you're not operating out of the back seat or the trunk of a car. So they will come and do a site visit to make sure that you have an operational clinic, that your clinic has the ability to maintain a certain amount of inventory. Although the inventory requirements and the display of inventory requirements are going to be different depending on whether you're going to be accredited as a medical supply company or you're going the non-accredited route. But you will be guided through that process if you're going through accreditation. Medicare medical supply companies, if you are going through the accreditation process, will most likely have to obtain a surety bond. So that's an additional cost. An additional requirement is that you have to be bonded. Medical supply companies will be required to have a compliance program in place as part of the accreditation process. Now, even if you don't have to go through accreditation, you should have a compliance program in place, okay? And Medicare may ask, do you have a compliance manual? They may ask, do you have a standard operating procedure for dispensing DME supplies, of what the steps are? So, but for the compliance program for accreditation, many times getting this compliance program together is part of that accreditation fee that you're going to be paying out to the accrediting organization. And also make sure that if you have any state licensing requirements, that those state licensing requirements are met before you apply to Medicare, because Medicare is going to ask for those licenses. And if you don't have them, then it's going to put your enrollment on hold. So just be aware of that as well. Now, I do want to talk to those of you who are thinking about going through accreditation for off-the-shelf back and knee braces. We discussed this in part 1, but I'll discuss this again, and we're going to have a much bigger discussion on this next week when we talk about how to become a certified orthotist to be able to fit braces to your patients. Now, if you are accredited, if you're going through accreditation as a medical supply company, I'm sorry, not NSC, but MSC, medical supply company, Medicare is currently under a competitive bidding round for off-the-shelf back and knee braces for the next 3 years. What this means is that if all you're going to want to do is offer off-the-shelf back and knee braces as a medical supply company, honestly, it may not be worth it for you to go through the enrollment to become a medical supply company. What it means is that you would have to bid and get into a bid to be the lowest cost supplier of braces in your area and win the bid to bill out for the braces. Now, remember, this only applies to off-the-shelf braces. Prefabricated custom fitted braces are not in the competitive bidding round. So if you're a medical supply company, then this only applies as far as the competitive bidding round. It only applies if you are under an accreditation situation. So for prefabricated custom fitted braces, Medicare is going to require a certification through BOC, and we're going to have Minerva Mendoza talk a lot about that next week during the webinar on becoming a custom orthotist to be able to do that certification. And we'll have that web discussion on how to obtain this certification and meet this Medicare requirement without having to do hundreds and hundreds of hours of training. There is an opportunity for you to get that certification for a comparatively low cost versus what it would cost to go through the full training to be a custom orthotist. So coming back and swinging back around to the question at hand is it worth it to become a DME supplier for Medicare? It seems like a lot of work to get credentialed, and it kind of is. I mean, there is a lot of legwork that needs to be done to get the credentialing, but I want you to think about this. Now, in our last webinar, we had Matt Snyder on, and Matt is a wholesale distributor for custom braces through JMS Medical Supply. And I've talked to other wholesale suppliers of knee braces and back braces. Your wholesale cost for your supply for the brace itself is going to run around $100 to $200 depending on the brace. Okay, now it could cost more depending on the type of brace that you're using, but the wholesale cost of the brace is between $100 and $200. The Medicare reimbursement for such a brace is going to be between $800 and $1,200 depending on your location and where where you're providing that supply. Okay, so you're looking at about a $800 to $1,000 profit margin on your brace, on the wholesale cost of the brace. Okay, so if you have the fortitude to go through the Medicare credentialing process to be a DME supplier, non-accredited, meaning you're exempt from accreditation, your cost, kind of all inclusive of all the different components, is probably going to run you about $1,000 to $2,000. Okay, and that's kind of broad strokes. What that means is that 2 braces or less will cover those costs, and you'll be a supplier forever. So if you supply 10 braces a month, the first 2 braces cover your credentialing costs. If you go the accredited route, the first 10 braces or fewer could cover your costs. To me, all right, if you have a reputable company that can help you navigate this credentialing process and walk you through it, and if you have to go through accreditation, if you have a reputable company that will help you get that accreditation, if you can get your certification as a custom orthotist, and you'll have a way to find that out next week as we have that discussion. It's kind of a no-brainer to me to go ahead and get the credentialing. It's not something you would probably want to do on your own. There are a lot of moving parts, as you can see, in the credentialing process. But if you have a company to help guide you through the process, or if you work with a credentialing accreditation organization to help move you through this, and you follow the steps and follow the recommendations, you can, within 3 to 6 months, you can have this credential and you can start dispensing DME to your patients. And so, again, for me, I will tell you that almost every provider that we have as a billing client of Gold Star Medical that has gone through the credentialing process with us and that has gotten the DME credentialing is very, very happy they did it. They don't regret it, especially if they offer the DME supply to their Medicare patients. So is it worth it? In my opinion, it is, but you have to make that decision for yourself and decide if this is something that you would want to do and move forward with. So I do want to let you know that we have an opportunity to help you through this process. Gold Star Medical does offer credentialing services for Medicare Part B, Medicare DME, Medicaid, and commercial plans. We have an entire credentialing department that can help you with really any of your credentialing needs. But in particular, right now, we're talking about Medicare DME. If you qualify as a non-accredited supplier, our typical fee to help you through this process is $500, which is 10 times less than going through accreditation. If you're watching this webinar and it is prior to July 31st of 2021, we are giving you an offer to save 20% on your credentialing fees. So your credentialing fee would actually be $400. And then of course you do have the additional, Medicare application fees and any state licensing fees that may be required. But to help us guide you through this process and help make this as painless as possible, it would be a $400 investment on your part. And if you want to do this, give us a call. Our toll-free number is 866-942-5655, or send an email to us at info@goldstarmedical.net expressing your interest, and then we'll get with you and we'll contact you on how to get the ball rolling. So that is our presentation for today. I do want to see if we have any Q&A. I don't see any open questions. I'm going to take a look at the chat box. I don't see any questions in the chat box, but at this time, do any of you have any questions that we can assist you with? See if anybody raises their hand. We do have one hand raised. Nope, we don't. Let's say one question, no questions. All right, everybody. Well, I want to thank you for your attendance today then. I do want to let you know that next week we're going to have a guest speaker, Minerva Mendoza, and she runs a very special school to help get doctors certified to be custom orthotists and meet that Medicare requirement. So I hope that you will attend next week's webinar, and thank you all for your attendance and for your participation today. Have a wonderful rest of your day, and God bless.